This is Dr. Edward Deutscher here at Tonicity Health and Wellness in Safety Harbor, Florida. And I'm here with Lacelli Wave, our manager who runs the business, and Marianne, our medical esthetician. And what Marianne is doing is some laser hair removal. And just some background, Lacelli was like the missing link before we started. And now you can see what's left. We're really doing touch-ups here. And let's talk about a little bit about how a laser works. What a laser is the word laser stands for light amplification by stimulated emission of radiation, which means you put electricity through an element, get it all excited like a neon sign, and then when it gets unexcited and goes back down to its normal state, it gives off a wavelength of light. Pigment, melanin, which we have all over our bodies, including in hair follicles, absorb different wavelengths of light, generate heat, and that heat is really what eliminates the hair growth. So what Marianne is doing is she's using a gel here, and the gel facilitates contact between the laser and the hair follicles. Now Marianne, why can't you do laser hair removal on gray hair?
Because the laser likes color. It will not see a gray hair follicle. It only sees the dark ones. So the darker the hair, the better. The lighter the skin, the better.
Okay, so what happens if someone says, yes, I have gray hair, but I dyed my hair black for a laser? What's going to happen?
And nothing.
Nothing, because the dye doesn't penetrate to the follicle. It only
correct. It hits above the skin surface, so it's not going to do anything. And don't do that. It
won't generate heat at the level of the follicle.
Exactly.
So in preparation for this, do you let people come in with long hair, or do you ask them to shave? How does a person prepare for this?
No, you want them to be shaved at least 24 hours in advance, or right up to the day before. That way the heat from the laser can go deeper into the follicle and not just sit on and burn the hair that's above the skin. You want it to go deep.
So if a person comes in with long hair, basically the laser will be absorbed by the pigment, the color in the hair, and it'll just curdle the hair, fry the hair.
Correct. It'll just fry the hair above the skin and not have any results.
Does one treatment eliminate all the hair on a person's legs?
No.
Or leg, or is it multiple treatments? How does it work?
It really varies by person, but it's usually based on how thick the hair is and how many follicles in the area. So everybody's different. It can take anywhere between, anywhere between probably 6 to 15, maybe even 20 treatments, but usually the average is 12.
12 treatments, and how far apart are the treatments normally?
On the body, the legs, they start anywhere between 6 to 8 weeks, and then they can be spread out based on their hair growth.
And why are you waiting between treatments? Is there a reason because of the hair growth?
Yes, because you want it to be in the growth cycle. You do not want it to be... Hair has 3 different growth cycles: anagen, catagen, and telogen. We want the hair to be in the primary growth cycle of anagen. So if we catch it when it's in telogen, that means it's just a dead hair, and we're just killing a dead hair, and we're not doing anything. So by switching the cycle that they come in, we can guarantee we're getting the hair at the right growth cycle.
So basically, treating hair is like treating parasites. If you kill the parasites, then if you don't treat the eggs, what will happen is the eggs will hatch, and you have to treat them again.
Yeah.
And which is why often you treat parasites 2 or 3 times. It's just so hair is basically a parasite in modern society.
Quite the analogy, but I agree.
I get it. And why were you spreading all the goop? What happens if you do the laser if it contacts the skin without the goop?
This particular laser, because of the wavelength, would burn the skin.
It would burn the skin. Okay. And this gel is really like ultrasound gel or things we've all experienced before.
Exactly.
All right. Okay. And does this hurt?
It's not comfortable. The client should be at a pain tolerance level between 1 and 5, preferably a 3. Where are you at, Lacelli?
I'm a huge baby, guys, and this feels warm. There's been a couple areas that got a little bit warmer than others, but for the most part, this is way less uncomfortable than getting waxed, and that hurts.
No.
This, not so much.
So this really beats getting waxed, is what you're saying.
100 times better than getting a wax.
Okay, so I will never get waxed in that case.
No.
I will come in. Now, what happens if you hit one of those? I'm going to show Laselli's tattoos here. She has her feet and ankle tattoos here. What happens if you accidentally or intentionally, depending on the case, hit one of those tattoos with a laser?
It's going to break up the ink in the tattoo, hence tattoo removal.
Okay, and why will it break up the ink in the tattoo? What's the
Because the
tattoo
ink
made
is
of?
pigments, and laser likes color, and the laser likes the pigments of the tattoo ink.
So, understanding is that the laser cannot distinguish different pigments.
Correct.
So
It cannot distinguish whether it's a skin pigment, a hair pigment, ink. It just knows that it likes the color, and it will just zap at it.
Okay, so you just said it likes the color. So what we can understand then is that different wavelengths of light, different lasers, are attracted to different colors.
Yeah. Then now you're getting into the tricky art of tattoo removal.
Okay, so with tattoo removal,
They have different wavelengths for the different color inks.
right, so what the laser
And
would do
That's
is,
trickier.
it's trickier. I'll add that the laser would break apart the pigment in the tattoo, and then where's the pigment go?
It comes
What?
out of the skin, like in a scab.
It comes out of the skin. Okay, so it scabs.
And some of it breaks up and goes out through the lymph.
Okay, so basically our body absorbs it. Once it's broken apart into small
It
granules.
absorbs it.
Yeah, it creates inflammation and it's broken apart.
Okay, let's do your other front of your other one.
Alright, so
Okay, so here we're going to the other leg, and once again you are spreading the goop.
Yeah, and I'm taking my goggles off to see if we have any adverse reactions. We
Now-
don't.
What's interesting is you just said that you're taking your goggles off because the laser is off. It's on standby.
Correct.
And the reason why you have to wear goggles for this is because we have pigment in our eyes.
Correct.
Right? So we have pigment in our eyes and we don't want to accidentally have anyone get hit. And that's it. So we're going to wrap it up.